Ladies and gentlemen, in celebration of the 5th anniversary of the Global Health Institute at the American University of Beirut, I would like to welcome all of you to the Global Health Changemakers Pitch Competition. Before starting our ceremony, I'd kindly ask you all to stand up for the Lebanese national anthem and the American University of Beirut alma mater. Have passed. 5 years of hard work, ups and downs, commitments, achievements, and celebrations. 5 years and the family is growing. 5 years and many fighters are here. Many fighters, yes, but the battle is won, shouting all together towards a Hakuna Matata world. They say every generation has the opportunity to remake the world. And we, at the Global Health Institute, say, we believe in youth. We believe in fresh blood. We believe in young soldiers guarding our future, the change makers able to raise our voice towards a future with no worries, a future with equality, safety, and health equity. 7 competitors and groups have made it till this point. 7 competitors holding 7 projects and ideas, and coming from different countries of the Middle East and North Africa region, coming from Egypt to Syria, Lebanon, the United Arab Emirates, and others, with one big goal, winning the competition and being a part of the better future. So may the odds be ever in your favor. Before starting our competition, I would kindly invite to the stage Dr. Shadi Saleh, Founding Director of the Global Health Institute, for his opening remarks. Dr. Shadi, the floor is yours.
يعطيكم العافية. Hello everyone. Opening remarks are always long, so I will try to keep them as brief as possible. The Global Health Institute was established in 2017 as the first and still the only institute dedicated to global health. The strength were that we are at the American University of Beirut, one of the most prominent universities in the region. Another advantage was that we are in the Middle East region, اللي هو the global health problems, يعني we produce global health problems. So 5 years later, we work across 35 countries covering Global South, including the MENA region, Africa, and a little bit of Southeast Asia. We cover most of the Sustainable Development Goals, اللي هن 17. But most importantly, the main critical success factor was that we have a team of 30 plus dedicated individuals who all of them, if they would have competed in something like this, each group would have won the pitch competition. And this is how we selected them. So as we celebrate our 5th anniversary, our goal is to find or to promote the next generation of global health change makers, partly to encourage interest in global health in general, but also potentially to recruit people to work at the Global Health Institute eventually. So for us, this is very important. For us, this is a testament of how much global health has advanced. We have 7 teams. The most joyful moment for me in our 5th anniversary is when they told me that the teams come from 4 or 5 countries, the finalists from 4 or 5 countries in the region. Haida for me is a great source of pride. I wish you all the best of luck. So for us, we are very invested in the 7 projects as an institute, as an institution. You have our promise. I'm personally, I read most of the portfolios, but I'm very much looking forward to hearing you in the pitch, because soon after in life, you'll find out that your whole life is a 5-minute pitch. You get your best job in 5 minutes. You get married in 5 minutes. Sometimes you get divorced in 5 minutes. But usually the 5 minutes rule is a good rule for all of you. So I look forward. Thank you so much. Nadine, back to you.
Thank you, Dr. Saleh. It is my pleasure now to introduce you to our esteemed judges. We have Mrs. Jessica Azar. Mrs. Jessica is a Lebanese journalist with over 10 years of experience. She focuses on freedom, youth, and women empowerment. She works with different associations and organizations to encourage young people across Lebanon and the MENA region. Mrs. Azar holds a master's degree in government from Harvard University, among other graduate certificates and diplomas. Thank you and welcome. We have as well Dr. Lama Moussawi. Dr. Moussawi is an associate professor of management science in the School of Business at the American University of Beirut. She is currently the Associate Dean for Research and Faculty Development at the School of Business. Dr. Moussawi also serves as the Director and co-founder of the Center for Inclusive Business and Leadership for Women at AUB, focusing on women's economic empowerment. Dr. Lama's research has attained national and international recognition, and she is the founding chair of the Women in Data Science Conference at AUB. Welcome, Dr. Moussawi. MP Dr. Najat Saliba. Dr. Saliba is a member of the Lebanese parliament. She is also a professor of chemistry at the American University of Beirut, the co-founder and executive director of Khaddid Beirut, and the director and founder of the Environment Academy. Dr. Saliba has over 100 publications and was nominated by Apoliticals among the 12 most influential people in climate justice and 100 most influential people in gender policy. In 2019, she received L'Oréal UNESCO International Award for Women in Science, among many other awards. In the same year, she was voted among the top 100 most influential women by BBC. MP Dr. Saliba, welcome. We move now to Mrs. Noor El Arnaout. Mrs. El Arnaout is a division manager at the Global Health Institute at the American University of Beirut, where she manages the non-governmental organization initiative. She also leads the Institute's electronic e-Sahha program focused on electronic health and digital health. She holds a master's degree in health management and policy from AUB and has more than 7 years experience in projects and program management, operational management, and research. She also leads the implementation of large-scale field-based service and research projects in underserved communities in Lebanon, including refugee settlements. Welcome, Mrs. El Arnaout. Finally, we have Dr. Rihab Nasser. Dr. Nasser is a professor in the Department of Anatomy, Cell Biology, and Physiological Sciences, Faculty of Medicine at the American University of Beirut. She serves as the Director of Basic Research Core Facilities and the Cancer Prevention and Control Program at Naif Basil Cancer Institute. Her research expertise is in cancer biology and therapeutics. She is also a recipient of several awards from international and national institutions, and she is the founder of Amaluna, a non-profit AUB-affiliated educational organization that aims to fight cancer by focusing on education, prevention, and research. Welcome, Dr. Nasser. Let's now start with our competition. Pitchers, are you ready? Yes. Okay, so a kind reminder that each of you has only 5 minutes to present his or her idea, followed by only 5 minutes of questions and answers by the judges. My friend and colleague Ala will give you a sign when you only have 1 minute and when the time is over. So please pay attention to the time. We start with the first pitch, titled Chatbots Meet Brain Health by Ms. Asma Jabr from the American University in Cairo, Egypt. Ms. Asma, the floor is yours.
Good afternoon, everyone. I am Asma Jabr. I am an MPH student at the American University in Cairo, and I'm deeply honored to be here today presenting my project, Salim, the Brain Health and Wellness Counselor. When I ask people what do they think of when they hear brain health, most of the answers are mental health. Actually, few would say the absence of dementia or Alzheimer's disease. And yeah, brain health is all about that. It's the preservation of normal brain functioning, mental well-being, and the absence of brain diseases. So why should we care about brain health? Because simply, we are all aging, even young children are. And human aging is mainly reflected in the aspects of brain aging and decline of brain functions. According to the WHO, in their first brain health report that was published 2 days ago, that 1 in 3 people will get neurological disorder at some point in their lives. Meaning that neurological disorder will be the first leading cause of disability and the second leading cause of death. As of today, there is no treatment or medication that can stop or reverse the damage to brain tissue. Therefore, prevention in the form of adopting healthy lifestyle habits is the most important thing that we can do for our brains. Because simply, what we eat and drink, how much we exercise, the way we socialize, how well we sleep, and how we manage stress are all critically important for brain health. However, people don't know that. There is a lack of awareness about brain health and lack of willingness to adopt healthy lifestyle among the general population. And here comes Salim's role to promote brain health and mental well-being among people in the Arab region. Given how people there are facing a myriad of healthcare challenges, including poor access to healthcare information from healthcare professionals. So moving on to the next point, people then go for digital platforms to get their information. And here we adopted Facebook platform to deploy Salim Chatbot, which is an artificial intelligence tool that simulates interactive human conversation, providing an accessible channel for health-related information, customized tips and recommendations for adopting healthy lifestyles. As we can see, that Salim will be working towards the Sustainable Development Goals, not only by promoting good health and well-being, but also by reducing inequalities related to healthcare access. So moving on from ideation to execution, the chatbot design will be in Arabic and performed in collaboration with a team of mental health professionals, neurologists, fellows from the Global Brain Health Institute, and university staff and students, and shaped by a user experience professional. Recommendations will be based on insights and strategies developed by the Global Council for Brain Health on 6 key elements that are known to be relevant to preserving brain health as people age, which are mental well-being, nutrition, exercising, social engagement, sleep, and cognitively stimulating activities. Now let's take a quick glimpse of how Salim works. Once the user initiates the conversation, the chatbot starts off by giving information about brain health and positively impacting healthy lifestyles. Then, the user provides consent to share personal information. After that, the baseline questionnaire that covers the 6 key elements of brain health. After that, tailored tips and recommendations will be sent to the user in a regular manner for 6 weeks in order for them to develop healthy lifestyle habits. Then, the follow-up questionnaire to assess the efficacy of these chatbot recommendations. Finally, we are hoping that Salim meets anticipated sustainable development goals and support public health professionals to develop better policy recommendations that work towards healthy aging. Thank you so much.
Thank you, Ms. Asma, for your presentation. Now I give the floor for the judges for their questions. Dr. Lama.
Thank you so much, Asma, for this nice pitch. I have a question regarding the privacy of the data. How do you ensure that this is the case?
The case of that the data...
Keeping the data private.
Okay.
Privacy of the data.
Okay.
Yeah.
So actually, there is a chatbot service provider that collects all this data, and all the data is stored on a database on this service provider. And definitely, it's going to be confidential and no data breach or some sort of this.
Dr. Saliba.
Thank you, Asma. You're saying that this platform is based on artificial intelligence.
Yes, yes.
That means it should have a database already.
Yes.
Correct? So where are you getting the database from? That's my first question. And my second question, how is it going to detect early functions or early symptoms of brain health? And how is it going to answer or to recommend better practices? عرفتي كيف? So how does it do it? Is it a watch that people are going to use? Or is it a question that you start asking? And what happens if you don't comply with those recommendations? So it's not clear to me how the process goes.
Okay, so regarding the first question, there is going to be a service provider, which is called SendBuzz. SendBuzz is a third-party service provider that has its database and it controls the hosting of the chatbot on Facebook. So this is for the first question. For the second question, our aim is not detecting decline of cognitive function or that sort of things. Actually, based on the baseline questionnaire and the habits people are adopting now and their answers in the baseline questionnaire, we're going to give them the recommendations that are programmed according to the chatbot. If the person, for example, doesn't exercise, eat lots of red meat, and, for example, doesn't sleep well and suffers from depression, this means that there's going to be tailored recommendation for that person based on his answers. And we're going to assess if he was complying to those recommendations or not by the follow-up questionnaire that's going to be after the recommendation steps are sent to him. And if the answers were changed, this means that this person is working towards adopting a healthy lifestyle. If not, I don't know actually what we're gonna do, but I think in the next future plan, we can do some sort of intervention for those persons in order to give them more motivation or more recommendations to help them to go for better lifestyle habits.
Dr. Nasser?
Thank you, Asma. So, you've mentioned you'll be using Facebook platform.
Yes.
Would this limit access to your target audience?
It's gonna limit my
So
access.
Who is your audience?
My audience is anyone who is speaking Arabic and can access the chatbot and start the conversation.
So would Facebook be the best platform where you can launch your app?
Yes. Actually, this is one of the future directions that we want to expand globally by going for another platforms as Instagram, Twitter. Twitter is not on the plan. Telegram, WhatsApp, and Instagram. And also, we're gonna add more languages in order for us to go global.
Okay, so one more question. So you've mentioned, based on Dr. Saliba's question, to follow up. You want to follow up.
Yes.
So would the participant, so how are you going to identify the participant? Would they have a surname and ID so that you can know them when they come back to the chat box?
Actually, the messages are all stored on the database, and based on the answers, after we do the analysis, we're gonna detect who the person is. Actually, people get IDs that are related to their names, and
Sorry,
yes,
Ms.
we can
Asma.
go back to them and send them more recommendations, as I said.
Your time is up. Thank you very much and best of luck. Thank you. We move now to the next pitch, titled The Use of Primary Healthcare Centers During Crisis for Pregnant Women, Study and Action Plan. This pitch will be presented by Ms. Mirna Jawhar from St. Joseph University in Lebanon and Mr. Ali Najdi from the Lebanese University in Lebanon.
Hello everyone. We are so glad to be selected in this pitch competition, and thank you for giving us this opportunity to be here today. My name is Mirna Jawhar, PharmD, pursuing my master's degree in pharmaceutical marketing at GHI.
And my name is Ali Najdi. I'm a master's graduate in immunology, and we are both colleagues at a company named Access Core, and we are very much interested in public health research.
We are living in the worst economic crisis that has ever happened in the history, and the healthcare system has nearly failed. Let us ask ourselves, how many of us know pregnant females suffering from the unavailability of the needed medications and the high prices? And how many times we heard them in the past 2 years asking about or complain about the absence of their gynecologist or physician due, unfortunately, who has left this country. So this led them in a continuous search for a solution. As per the MOPH, the number of women dying from pregnancy-related complications has nearly tripled, and the newborn death increases, which is also an indicator of the poor antenatal care. Therefore, the readiness of the primary healthcare centers can be a solution to provide an adequate and affordable services for the pregnant women and their newborns, and this will be elaborated by my colleague Ali.
Thank you, Mirna. First, for those of you who don't know, primary healthcare is a network of centers that is distributed among the Lebanese territory. And the main goal or the main services that these centers provide is health at a very affordable price and nearly free of charge. This is funded by mainly the MOPH. Right now, due to the causes and the struggles that pregnant women in particular are facing in Lebanon, if a government says that I want to invest in primary healthcare, let us assume that we have a fund right now. Do they know where to spend the money? Do they know how to spend the money? And do they know why to spend the money for a very particular reason? And here comes the role of our project. Our project is an extensive study, evaluation study, for the readiness of primary healthcare centers in Lebanon to host a very specific service, which is pregnant women healthcare. Our main goal is to provide evidence and data to decision makers, policy makers, that will help them in case they get a fund, in case they want to implement a plan. They will have solid data about each center or the sample that we will select, the needed and the gap that are found in these centers, and how we are going to invest our money in them. Speaking about the global development goals, sustainable development goals by the UNDP, we will be contributing mainly to the third goal, which is good health and well-being, in three main aspects. Goal number one, we will reduce the global maternal mortality rates. We will reduce the death of newborns, and we will contribute to attaining universal health coverage in Lebanon. And for the implementation of our project, Mirna will now share it with you.
Okay, we will be covering 4 perspectives. First perspective will be about financial perspective, which will be related to the funds that each primary healthcare center receives. We have the logistic perspective, which is related to the building status inspection, the power supply and demand, the equipment. We have the operational perspective, how each primary healthcare center operates and their link with the MOPH. And we have the human resources perspective, which is related to the currently existing staff and the healthcare providers. This project will be implemented during 9-month period. And we have phase 1, which will be about existing data review. Phase 2 will be about sample site visits. Phase 3 will be about collecting data and report writing. And phase 4 will be about dissemination of the results.
Speaking about the dissemination of results, so our final product will be a full report that is reflected by the study. And this report will be shared for professionals, local and international, that are interested in public health and in women health in particular. In addition to, we aim to publish our work in a journal, and of course, to have NGOs that are interested in women health to have this data that will help them eventually. In the end, public health and access to health is a right, and no crisis should be an obstacle in front of that. Pregnant women in Lebanon have been suffering and are the victims of this crisis, and so we believe that our project.
Thank you, Mr. Ali. Thank you, Ms. Mirna. Dear judges, the floor is yours for your questions. Mrs. Al-Arnaout.
Thank you, Mirna. Thank you, Ali. Operationally speaking, how are you thinking to select the centers? You know, there are some centers who serve a lot of underserved populations, others that serve less underserved populations. This is the first question. Second, there are, in many centers, we know that there are interventions that are happening that aim to improve the uptake of antenatal care services for pregnant women. So how are you going to take this into account in your project?
If I may, Mira. We have existing data published by the Ministry of Public Health, and there was a program to provide prenatal services for women that was launched, I think, after the Civil War, I think mid-90s, but it stopped in 2003. So there is a data. The first phase that Mirna mentioned will be mapping the already existing data and everything that we can find that will give us information about each center. Based on the mapping we will have, and based on the fund, we will select the samples, because we have 256 centers in Lebanon. So if we get enough fund, we will map them all and we will study them all. If we didn't, we will have a certain sample based on the geographical location and based on the amount of people that they serve.
We have Dr. Saliba.
Okay, I'm good. So this is a very good project, and you did a very good job in pitching.
Thank you.
You know, are you aware that the PHC centers, they have their own software, right?
They have their own software, but it is not linked centrally to a main software for the Ministry of Public Health.
No, it is.
As a software, as a digital software?
Yes, the Phoenix.
Okay.
Right.
Okay.
So that's already done. The second thing is, in your title, you talk about pregnancy and women. And then when Mirna pitched, she focused on pregnant women. And when you pitched, it was about everything else.
Okay.
So which one is which? What do you want to do? So that's not clear, okay? Because you talked about identifying the gaps in operation, human resources, and all of that, whereas Mirna is talking about improving the service for pregnant women. So that's my main question. And the third question is, what is the relation between PHCs and NGOs, and why should NGOs be involved in PHCs?
Okay.
That, just to tell you why I am becoming very sensitive to this, because I want to protect the public service and the institutionals,
Of course.
and the institution centers that are working very well. And I know that the PHCs in particular are very, very good centers, well managed by the Ministry of Public Health. Thank you.
So answering your first question, I mentioned in the pitch that the evaluation that we are going to do is for a very specific job, for a very specific service, is the readiness of the primary healthcare center to host services for pregnant women. So that's the link. Maybe it wasn't very clear from my side. For the second question, we are in a time of crisis, and the main reason is the lack of dollars that we can spend. We have lots of plans and lots of, so any fund, I think even the fund, if the fund came from an NGO related to women, it might be of a good thing to the government, but it must be managed centrally by the government to invest in primary healthcare centers.
So I go back to what Dr. Moussaoui said in the previous question. There is a huge problem in protecting people's data. So if you give the data to NGOs, are you going to make sure that those data are going to be centralized in the Ministry of Public Health? That's a very important issue that we are all, suffering from. Thank you.
Thank you.
We have a question from Dr. Moussaoui.
Yeah, if you can please clarify to me, you mentioned when you were pitching that it's the shortage of physicians and gynecologists, a big issue during crisis. So how is this going to solve that issue? How are you solving this issue?
Yes. In the primary healthcare centers, there should be a gynecologist or midwives or physician, and due to the crisis, many females cannot afford to go to their specialist. So in the PHC, if there will be well organized and referring to the gynecologist that will be working and have experience in these PHC centers, so we will work with them.
Thank you. Thank you, Mr. Ali, and thanks, Mrs. Birna, and best of luck. The third pitch will be presented by Ms. Emma Sleiman from the American University of Beirut. Ms. Emma's project is titled Bay Youth.
Thank you so much. Hi, everyone. My name is Emma Sleiman, and I am a pre-med student here at AUB. So I wanted to begin with a story. A few years back now, I volunteered at a special center for people with intellectual disabilities, such as autism, with major learning deficiencies. And so I like to ask questions. So my first question was, what is the educational system like there? Is it secondary and then uni and then you get a job and everything is good? And the professor to whom I asked this question to was laughing at me. He was like, you know what happens? People with autism will eventually grow to learn some manual skills and do crafty things like the soaps or the things that you see in usually fairs all over Lebanon. And then at 22 years of age, they won't have income anymore from their own schools. So they will find other programs such as Kafa, etc., to eventually enter the workforce if they enter eventually with time. That is the reason why you do not see them in your workspaces. And this is also the reason why from 50 to 75% worldwide of people with autism are underemployed. Now, this remains for two factors. One of the factors is, eventually, social stigma. So employers, to open new markets, they have to train these people to value them properly. And so they will have to put time and effort, and they think that learning disabilities are not for people, are not for the workforce. And second thing, communication. We are in a world, as you can see here, that relies more and more on communication. So the manual skills that they were good at, bye, for the 20th century. Now, if we cannot bring them to the world so they can test and eventually practice and go into new markets, what we want to do at Beirut is bring the world to them. How? It's not magic. I brought with me the VR cask through virtual reality. Now, for the youngsters, it's the metaverse. For the less youngsters, this virtual reality headset, when I put it on my head, it is going to be acting like my eyes. So I will be in a new environment. I won't see you here. And the environment will be very interactive. I can go there, see 360 degrees. It's very interactive. So my plan is to develop VR-based capacity building trainings for students with autism, with mild and moderate autism. What happens exactly is that we administer these VR with occupational therapists, so it's not alone. Occupational therapists will choose from a variety of courses we will give in Beirut, from communication to functional skills, and they will administer them to students with autism. Imagine people with autism being confronted with interviewers in a very corporate setting, or being in front of a public where the population is growing and growing as difficulty raises with time. These scenes could not be replicated in real life. It's very difficult to find interviewers in a very corporate setting for them, right? And so, on a business level, how is it going to be happening? Our end users are students with autism. Obviously, we have more than 50,000, approximately 400 students with autism. Now, we still need more information about the data set of these, in fact. Our customers are of three types. We have, of course, parents who can afford a cask of $200, so it's as costly as a computer. We have private schools, special schools, that will have to have VR labs, also as costly as a computer lab. And third, we have occupational therapists, therapists to accompany the people with disabilities in their own private clinics, such as psychologists in their private clinics, speech therapists in their private clinics. And so if you want to see Beirut as, in terms of the business model, it's like Coursera. So Coursera is a platform that gives courses that you have to pay for in different skills, areas of assets, etc. And so Beirut, it's the same thing. It's Coursera for people with learning difficulties. And so the occupational therapist, for each course, depending on the skill they want to develop in the person with the autism, will have eventually to buy the course and download it and eventually administer it to them. Now, the VR market is a market that is exponentially growing. So VR will reach by 2030 $87 billion. And with this exponential technology, we are advancing in SDG 3, education, no, it's well-being, SDG 4, education, and most importantly, reduced inequalities, SDG 10. So this is the vision that we hold, and the vision turned out to be in our headsets, which are the VR headsets. And the vision turned out to be Beirut. Thank you.
Thank you. Thank you, Ms. Emma, for your pitch. Now the floor is yours, the judges, for your questions. We have Dr. Nasser.
Thank you, Emma. Very nice pitch. My concern was mainly about the cost. How are you going to reduce inequality or inequity, whereas you mentioned that it is very expensive and probably autistic child who are from poor families would not afford this?
Exactly, so that was the main concern, and actually that technology was studied in the 90s, but it wasn't that popular. Why? Because it was very bulky and very expensive. Now it's getting, as we go in time, less and less expensive. And this is why our main target audience at first are private schools for people with autism, so that we can really tackle them. Now we are collaborating, and we want to collaborate now with a school that is private and can eventually buy 4 casks, so it will cost them the cost of a computer lab. And this is something that we take into consideration. We think that our customers are not going to be single parents. We're going to bring that in their houses, but rather centers. With time, there's also an outgrowing number of VR labs who are offering also their VR for a certain set of time for free as well. So they will just have to buy the software in itself.
Dr. Moussaoui.
Thank you, Emma, for the pitch. I love the topic. I have 2 questions. The first one, Can you shed light a little bit more on how you're going to design the content of these modules or courses? And also, I have a concern. It seems to me that this is not, I mean, we need to prepare, we need to build capacity of student or young people with the autism, but this is like a one-way solution. Like, how do you ensure that when this person goes to the interview, this person is going to be interactive enough, ready, right? Because so if you can elaborate a little bit more.
Yeah, I totally understand. I mean, we have, in fact, to have much more research on that topic, but at least the research that have worked on virtual reality outside, there are competitors, a lot of them, like Florio VR, that are doing this abroad. And so basically what happened is that usually people with autism, they face a lot of tantrums or meltdowns because there is, you know, and the main cause of these tantrums are eventually new environments. So whenever you're shedding light or making them or putting them in a certain environment in VR, in a very, you know, secure environment, and then putting them outside the world, we have first, this is for sure depending on research and also depending on pure logic, we have less chances of tantrums occurring for people who have autism, so less meltdowns, that is first. Now we need further research, as you mentioned before, we need further research to see what are the consequences and how we can follow up and eventually have the key metrics. Now for how we're going to build these prototypes, we have built a prototype before. We're outsourcing our talents. Usually here in Lebanon, it's still new, so not all people know how to have a 3D design. But we have a lot of people who are working in no-code metaverse platforms, and the prototype is going to be then developed depending on funding, with AI as well integrating it, so that we can have more functionalities and eventually better design for the project as a whole.
Dr. Saliba?
Just to follow up on the question that Dr. Musawi asked, you are making the assumption that the person who has autism will not have the same reservation intimidation when they are in VR. Is this true or not?
Yeah, we're making the assumption and we're trying, but like universities like Yale have, the Brain Institute in Yale has done this, and they have had consequent results that are positive and show that this assumption or hypothesis is positive.
Mrs. Azar?
Hello. So that's not a problem. At what age do you think the person should start taking these lessons you're talking about?
That was the same question I asked for the professors we worked with in terms of interviews. And they were like, because in people who have autism, we need early age intervention. So the younger, the better. Now we're working, you know, usually in autism, we don't talk about age, we talk about the case. So we would like to work with people who have mild and moderate autism. So the ages may vary, but the capacity is the same, mild and moderate people with autism. The younger, the better.
Mrs. Larnaout?
Thank you, Amma. Very nice pitch. I have a question. So you mentioned that you have an assumption based on a study conducted in Yale, but you're actually going to implement this project in Lebanon, right, or somewhere in the region. And the region is characterized by a specific context. So how are you going to ensure that this innovation is context specific?
So we would like in the future to collaborate with institutions who are working actually being pro-able. I'm going to give the example of pro-able. So pro-abled's job is basically to match employers with people who have disabilities. And so our idea would be a first stage, and then we would have, if in the future this idea is developed, we could harness a collaboration with them to see if in fact the employments have been higher with them after using our own VR solution.
Thank you, Ms. Emma, and best of luck. We move now to the fourth pitch, titled Prevalence and Determinants of Non-Communicable Diseases and Potential Barriers in Utilizing Healthcare Services Among Laborers in Ajman, United Arab Emirates. This pitch will be presented by Mr. Zishan Zulfikar from the Gulf Medical University in United Arab Emirates.
Hello, good afternoon, everyone. I'm here from UAE, and the university is based in Ajman itself. So as you can see, my topic is a very broad topic, and we are trying to focus mainly on the marginalized population in UAE, which can be considered as the labor population. The UAE is a very advanced country, and it has a lot of amazing healthcare centers. And it is rated as one of the best globally, and we also have an amazing tourism for medical patients and stuff. But the thing is, who are being left out is the labor population. We have the labor population here, and the best medical healthcare is here. But there are some barriers stopping them from reaching and accessing those medical centers. So my study plans on destroying these barriers so that those people who are suffering can reach to the medical centers. And we are focusing mainly on non-communicable diseases. As recent times, COVID and other pandemics and endemics have been there, people are very much aware of the communicable diseases and doing the most to prevent them. But what about non-communicable diseases? In the recent years, people have stopped caring about the non-communicable diseases, which includes blood pressure and diabetes, cancer, everything inclusive. According to the previous report, the progress report on SDG 3, which is healthcare and well-being, which aims to provide healthcare, quality healthcare for everyone at all ages. We are missing that. And the progress made was near negligible as per WHO. And this report was drafted in 2021, June. Every year annually, globally, more than 15 million people die premature deaths due to NCDs. And in UAE itself, a country with a population of 9.9 million, 4.4 million are just the expat labor population. And out of them, the 82% who die prematurely within the labor population is 82% who die prematurely in labor population is due to NCDs. So we want to do a study, conduct a study, keeping them as our basic participants, like they will be the only ones we focus on, by a questionnaire. And moreover, the questionnaire is a very broad questionnaire. It will include everything. And if there are current patients and on medications, that all will be considered, including the social demographic characteristics, just to get a clear-cut picture on how we can make their lives better and make sure they have access to the best quality healthcare which is available. Again, based on the SDG number 3, quality education, and it is the providing the ultimate care package, ultimate care health. After the study, we plan on including NCDs as part of the insurance plans and to include it in primary health care so that those people are able to access the health care. Mainly, it's the cost which stops the labor population. So our university hospital has conducted multiple camps for free just to ask the people why do they come for the free camps and not for normal checkups. And on that, we got the review, it's the cost. So other than cost, there are some factors which are stopping them, but we are not very well aware of them. So I hope that this research will be able to put out everything that's stopping them and destroy all barriers so that that marginalized population can reach up to this amazing healthcare. Thank you.
Thank you, Mr. Zishan. Now I open the floor for discussion. Dr. Nasser.
Thank you. So this is a research.
Yes.
Okay. Do you have first the ethical approval to run your research?
Yes, we do. And we have applied for the ethical approval from the Ministry of Health in Ajman itself, so that after conducting the research, we can give them the results, and they'll be able to take the necessary actions to provide better healthcare.
So this is a topic that was not studied before in UAE?
No. It was
So we
not
don't
done
know
before.
the prevalence and the determinants of NCD as well as the barrier among...
Within labor population,
Okay.
specifically.
So this is the novelty, the population that you'll be studying.
Yes, I'm focusing on the labor population.
So the outcome of your research would be a publication or a report or whatever.
Yes.
So will there be any recommendation to help these people cross the barrier to access healthcare?
Our aim is to change the policy. As of UAE, we have the policy that every labor person should have insurance, medical insurance. But again, companies go for the insurance, which is the very basic insurance. And NCDs is not covered in those insurances. So our aim is to have NCDs integrated into those compulsory insurances.
We have a question from Dr. Moussawi. Oh, Dr. Salih.
Okay. So do you know the prevalence of what NCD is now among laborers, or we don't know?
We, on basic review, not clear studies have been done, like there's lack of literature, but on basic review done by non-credible sources, out of the 4.4 million population, the labor population, the people who are dying prematurely within UAE, Ajman, is due to NCDs. This is based on the basic hospitals that the deaths we receive. The cause of death is NCDs, which includes blood pressure, heart attack, stroke, multiple things.
And do they receive any health care now or no?
No. As of now, they have the basic emergency health care and accidental health care, but NCD, no. It's them on their own. They have to deal with it.
Thank you.
You're welcome.
I see no more questions from the judges. All right. Thank you, Mr. Zishan, and best of luck.
Thank you.
We move now to the fifth pitch, titled Impact of Exposure to Heat on the Physical, Social, and Mental Health, and Coping Strategies Among Construction Workers in Ajman, United Arab Emirates. The pitch will be presented by Mr. Abdulrahman Shikar Omar from Gulf Medical University in the United Arab Emirates.
Thank you very much. Hello, everyone. My name is Dr. Abdulrahman Omar Shikari. I'm originally from Nigeria, but currently based in the United Arab Emirates. I'm a second-year MPH student with the Gulf Medical University. Basically, my project is about impact of exposure to heat among construction workers and the effect it has on the three health domains, the social, the mental, and physical well-being. And the coping strategies among the construction workers as well to mitigate the effect it has on them. First of all, the definition of health by World Health Organization is not just the absence of disease. The person has to be mentally sound as well and economically productive. Without one of these, the patient is considered unhealthy. And as well, we know according to World Health Organization as well, the construction workers are among the vulnerable groups because they are economically disadvantaged. They are outdoor workers, so they are uneducated, so they are considered vulnerable groups. And we know that recently, the global, not just recently, but in the recent years, global warming is destroying the world all over. When we talk about global warming, most people think about the high-rising sea levels, the hurricanes and wildfires. Nobody thinks immediately about heat waves. As we see recently in the UK, one of the coldest countries in the world, because of the heat wave, because of the the effect of the global warming, they reached, I think, an all-time level of highest temperature in the United Kingdom. So not much research has been done regarding the effect of heat because it doesn't affect the countries that has, you said to say, what do you call it? Resources to conduct those researches. But in the United States, in the United Arab Emirates, about 96% of the people that work in the private sector are migrants. And of those migrants, majority of them are construction workers. Just recently, a study conducted in Hong Kong revealed that with increase in heat and heat stresses to construction workers reduces level of productivity, which in turn reduce economic, what do you call, affect the number 8 SDG, which is decent work and economic growth. And then it also addresses SDG number 3, which is good health and well-being. So we're trying to find out all those problems that lead to, unhealthy lifestyle or unhealthy living. And as well, some of the construction workers, the coping strategy, unfortunately, some would do something that is really positive, but some would engage in something that is negative to their health as well. Recently, I was at a camp, labor camp in United Arab Emirates in Ajman. I realized that most of the construction workers don't have good sleep because of the stress they go through during work, because they work. If most of you have been to one of the Middle Eastern countries, you know that from 8 a.m. or 6 a.m. in the morning, the degrees is like 35 or above, and it remains constant till midnight. And the humidity is really high, so it increases the chances of work-related injuries, like falling because of the sweaty palms, and they don't have the right equipment or right, protective equipment to protect them from all those problems. So we aim to look into those problems and then see how we can recommend to the Ministry of Health or to the Ministry of Labor to see they incorporate all these problems, all these solutions, to see they have curtailed the problem, and as well recommend to the Ministry of Environment as well to see if there's any, recommendation we can give to them. They can plant more trees to reduce the heat, or to reduce the temperature at least, and recommendations to the construction companies as well to make sure that the laborers are protected and given equal opportunity like others. Thank you very much.
Thank you, Mr. Abdul Rahman. Now the floor is open for questions and answers. We have Dr. Musawi.
Thank you, Abdul Rahman. This is a unique idea and very relevant. You talked about recommendations, so it seems to me that the outcome of your project is to come up with a series of recommendations. How did you reach those recommendations? Are these based on, I don't know, like maybe interviews? So how did you come up with these recommendations?
Actually, we're going to, give them self-structured questionnaires and interviews to different labor construction sites in Ajman. We talk to the laborers as well, one-on-one, and then we get to know their problems, and then based on the questionnaires as well, we get to formulate, okay, these are the problems, and then we come up with the recommendations. Thank you very much.
Thank you. You said in your speech that you noticed that some of them don't have good sleep. How did you notice that they don't have good sleep? That's the first question. And the second question, give me one strategy that you think of that could cope to reduce the impact of exposure to heat. Okay, what do you think about this strategy? But the first thing, how did you know they don't sleep?
Okay, like I said, we usually conduct health outreaches to labor camps in Ajman because, like I said earlier, they're the vulnerable groups and most of them are uninsured. So going to the hospital is really hard for them. They either spend the money, the little money they get, and then in return, they don't send to their families overseas. So we conduct free medical outreaches from my university. And like I said, I realized most of them, based on the questions, most of them come with complaints of headache or just routine blood pressure check. Then you find out that their blood pressure is high. And if you ask them, most of them, they will tell you that they had less sleep. Some of them spent the whole day in the sun. And when they get back to their rooms, it's not well ventilated, and then the ACs are not really working sometimes. Because as we know, not everyone cares about them because, like I said, they're vulnerable group. So because of that, lack of sleep gives rise to the blood pressure and series of headaches, which in turn reduces productivity, which as well affects the families overseas. So this is basically one. And the second question, sorry, if you don't mind me asking it. Recommendation. Okay, so one of the strategies I think we would want to is to make sure they have intermittent breaks. Instead of staying for long hours in the sun, they have intermittent breaks, and if possible, mobile cooling rooms with AC so they can sit there and get their temperatures down, because the work they do is physically demanding and it increases the core temperature of the body. Coupled with the fact that the surface temperature as well is high, so it can cause heat stroke and stuff. But if they work for less hours and then get breaks, intermittent breaks, and use of cotton jackets, it absorbs moisture as well, so it reduces the effect the humidity has on the body temperature. Yes.
A question from Dr. Nasr.
So I have a question about the questionnaire that you'll be using to assess the physical, social, and mental health.
Yes,
In which language will it be, and is it a validated questionnaire?
We will first validate it before we give it to them in the pilot questionnaire. Yes, but we will validate it across, because not much research has been done on this topic itself. So we would do the questionnaire and try to validate it with the little research that has been done. And we will do it in the language they understand. But most of them can read or write, so we'll do it either in, and most of them are from the South Asian countries, like India, Pakistan, Bangladesh. So we want to do it in Hindi, if possible, because it's more universal to them. Yes. And we have a translator that can help translate to them. And we would do back translation as well. We'll do it in English, we'd translate to Hindi, and translate it back to, yes. Thank you very much.
Abdurrahman, you're talking here about conducting a research study, right?
Yes.
What makes you so sure that the government is going to adopt your recommendations?
Well, I wouldn't say I'm so sure, but it's a really important topic, and I'm sure if the government, because like you said, the main aim that we are here today is the SDGs. And every government is trying their best to see that they fulfill at least 1, 2, or 3 of the SDGs. So I'm sure with the findings we make and recommendations, the government will be willing to take our idea up, inshallah. Thank you very much. Thank you very much.
Thank you, Mr. Abdurrahman, and best of luck. Now we move to pitch number 6. It's about CancerCom and will be presented by Ms. Sara Al-Kousa from the Lebanese American University in Lebanon. Ms. Sara, the floor is yours.
Hello, everyone. I will start with a question. Who among you knows someone who has or had cancer? That's a very decent amount. But this is not strange, because according to the WHO in 2020, there are 28,700 plus cancer patients in Lebanon alone. And among these 28,000, there was Fadia. Fadia is a 53-year-old middle-class housewife who was diagnosed with breast cancer. And upon diagnosis, she had no idea what that meant. Her entire journey was focused on finding, covering, and taking treatment. And she had to face post-treatment side effects on her own. And during this entire journey, her family received ultimately no support. Not when she was diagnosed, not when she had reoccurrence, and not when she passed away. And I know that. I sadly know that because Fadia was my mom. And I also know that this story is not unique. So I decided to do something about it. We started a page to raise awareness on all cancer types. We linked patients to entities that can support them directly. And we started offering free online nutritional consultations with the help of LEU. And all of this helped build the identity of CancerCom that I'm presenting to you today. CancerCom aims to support cancer patients to combat cancer in community. And we don't only focus on patients, but also on their family members and on survivors. And to enhance the service, we came up with a digital solution. It will be the go-to application for cancer patients and their caregivers, guiding them on how to manage symptoms from a multidisciplinary approach. Available support systems that they can go to, like NGOs and centers. Available medications and the ability to request one if not available. It will also have a 24/7 access for a live chat with an onco-nurse that will be there to support them and will be tracking their progress through the app via basic AI. This is what we aim to accomplish in the first year. But we also aim to grow to include booking of affordable consultations with nutritionists, psychologists, and physiotherapists. This way, the next Fadia diagnosed will not be as confused and will have everything available for her just under her fingertips. If we come to look at what's available out there for the patients, there's the DRAP application that links general patients to doctors. There is the Ministry of Health application that gives the pricings of the medications. There is the AUB MyChart that links the AUB patients to their doctors, and it's a health record, online health record. And there's one application specific for cancer patients. It's called OncoMate, and it supports with symptoms management. Now, we looked into the MENA region. There is no application that is specific for cancer patients, but there are two that support with finding meds, one in Dubai and one in Qatar. And outside this region, there are 14 successful cancer-specific applications, and 4 of them share common features with what we aim to provide. So this will be the starting point for our app. We have started with the Millennium Fellowship under SDG 3, Good Health and Well-Being. And we have one for the app idea and the UN Global Compact Lebanon that support social-oriented startups. And right now, we are being incubated in LU Spark to develop our business model and implementation plan. In the past few months, the Prime Minister, Najib Mikati, has been calling on international bodies and donors to support cancer patients in Lebanon in this crisis. And this is exactly what we're doing, supporting them through every step of their journey. Thank you.
Thank you, Ms. Sarah, for your pitch. Now I open the floor for discussions. You have Dr. Saliba.
Hi, Sarah. The first question, and it's an easy question. It's usually when there are apps, anybody who proposes app, they think that it ends when the app is completed. In fact, the problem starts when the app is completed because managing and operating the app is where the cost and the headache starts. Have you thought about this part? Because this part is not to be underestimated. So that's the first question. My second question is a general question, and it's based on my ignorance about the medical topic. Okay, we are hearing so many people proposing apps for any kind of diseases, right? But I also understand that everybody and every case is unique. That means you cannot just generalize and put things under categories. In the contrary, people, when they go to the doctor, they expect this unique interaction and they expect a unique treatment. So how do we make the app treat the body or the person or the patient as a unique individual that has a body with special characteristics, right? I mean, of course we talk about AI, and I know very little about AI, but I do not understand how AI can have all these answers. Okay, thank you.
So for the first question, as part of LU Spark, we have been assigned recently a financial mentor, and we're working to see the financial projections to know how we will need the funds and where to put what, and we'll definitely take into account the sustainability of the app. For the second question, so basically what we mean by AR for this app specifically, so the idea will be that the patient will enter basic information. There's a place where they put their health record, and we will continuously be asking them questions like small surveys, small pop-ups, and the idea of the AI here is just to compare. So this patient started with this weight. 4, 5, 6 months later, they became this weight. So there's a huge drop. So the AI would directly send an alert to the managing onco nurse and be like, this patient lost a lot of weight. So the nurse would contact the patient and be like, hey, you've been losing a lot of weight, what's going on? Maybe it's because of a symptom, maybe because we see what's going on, and then the nurse would be like, either direct the oncologist of the patient or give certain recommendations, or maybe direct to a nutritionist. So this is what we mean here in the app specifically. The AI is to do the comparison of if the patient was like this at the beginning, they're having more mood swings, more depression, look into it, and the onco-nurse would go forward and contact the patient directly.
Another question from Dr. Nasser.
Okay, so basically I applied here alone because there's a very big team. We started as an initiative, as I mentioned before. So we have a research team that is doing whatever content we want to post, awareness posts, and they're like 6 medical students. We have high schoolers who do the poster designs. We have advocates who want to make a difference, and these are in the impact team. What we do is that when we get a case, for example, someone searching for a med, this impact team would search, go ask NGOs, ask pharmacies, do you have this medication or not? So we're a very big team, but I'm the one who came with the idea, and that's why I'm Yes, yes. So basically, definitely, yes. So that's why I decided to take a step to turn this initiative into something else because of sustainability. So when we started, I reached out to the nutrition program in LEU. I was like, this is missing, we really need to do something about it. And they were very generous to say, okay, we're gonna give you interns under the supervision of an expert. So, and it became integrated as part of the course of the nutritionists. But what we want to do is help it stay sustainable, right? Exactly. So what we were thinking about, so actually the onco nurses would be, we're going to ask them once we start, actually when we have ultimately nothing coming in or out, to ask if they can give 1 or 2 hours of their time just to answer texts. Pro bono, exactly, to help. And then once we start having traction, we can start talking about ads, we can start seeing how we can generate, and this is then we will have enough traction to say, okay, I'm gonna hire a full-time nurse. Regarding the consultations, they're gonna be charged, but as I said, affordable. And here we were thinking of using the youth. So we have a licensed dietitian who can give this consultation, but she doesn't have a clinic. So she can give this consultation online with a very good price. So this is how we're thinking about it.
Thank you. Thank you, Ms. Sara. Finally, here's our last pitch titled The Smart Psych. It is prepared by Ms. Mariam Al-Boushi from the Lebanese International University in Lebanon and Mr. Muhammad Badi' Al-Fathi from Karabuk University in Turkey, and the project will be presented by Ms. Mariam Al-Boushi.
Hello, everyone. Ladies and gentlemen in the hall, who hasn't passed through a dark spot in his life? And how many times did you search it for someone to guide you to reach the light by the end of the tunnel? But unfortunately, you didn't find any. But now, there's no worries, because we, Friend Psych, are here to provide you with our smart psych system that will hug you during your bad days and dark times. Actually, I want to tell you some, maybe they are unpleased and unsurprised facts. Do you know that there's about 29% of people who are living in the MENA region are suffering from depression? And there are about 35% of people are feeling stressed at this moment. And actually, people are the most important problem that makes it worse is the social taboos that people are still caring about. When it comes to talk about their mental health illness, they become like shy about it, and they face many taboos in the society, so they become inconsistent in their treatment or behavioral treatment. So now it's the time to take an action. We, you, and our smart psych system are here to solve the problem by protecting people from the occurrence of depression, by the early avoidance and the early protection of it, and by treating the existing cases, the people who already have depression. Also, we as a Smart Psych system are aiming to establish our AI mental health foundation, which is directed to all mental health disorders in order to meet the third goal of the SDG, which is well-being and raise health. Also, our project is directed mainly to all MENA region, and especially to those who are early health seekers and people who were affected by displacements, wars, crises, and anything like this, like people who were affected by Beirut explosion, refugees, or women who are suffering from domestic violence, and children too. This can be solved by our AI mental health system that with its automated apps and bots, and also by its automated services. We can provide users by an accessible and easy and private access to an interactive system and interactive exercises that they can perform in order to reduce their depression. Also, we can connect them with our psychotherapist and psychologist platform, and we can make them caring about their mental health by raising awareness among them, and by the early avoidance of depression by our AI advanced techniques. Also, this problem can be solved by increasing awareness among people, and our project works in this way. Mainly our project and our AI system is made up of 3 phases. The first phase is the protection phase, where it's directed to all people and to everyone, and this is performed before the occurrence of depression, where we protect people from the occurrence of it. So we can make for them, we can track their sleeping, their eating, their movements, and that we can use our AI system and our AI advanced techniques in order to detect where depression is going to happen. Our second phase is mainly for when the patient shows some symptoms. So here we can diagnose him with depression, and we can give him a treatment plan in order to work on it and to treat it. Also here we can connect him with our platform and psychotherapist platform. And here he can provide them with a platform that can help them. Our third phase is for the diagnosed patient and those who have early depression, where we can track them and help them improve their quality of life. We can get, what makes us different is that our system provides all features in one app only, and also it makes a sentimental analysis for people. Also, it can connect patient with its physiotherapist through our platform, which is a part of our system. Also, we can get some support from many global and local institutions and organizations like Relief and LPSA. Also, we can get from MAPS, from International Relief and International Care. Also, my colleague Muhammad is a part of the MIT Innovation and MIT React, so we can get some help and support from them. Thank you very much.
Thank you, Ms. Mariam, for your pitch. I open now the floor for discussion. Mrs. Larnaout.
Thank you, Mariam. Great project. I have a question. Is your app dependent on internet connectivity?
Yes, of course. It's not on internet connectivity. It's on the patient himself, because we provide voice tracking and eating tracking and some techniques that depends on some access that the patient can give them to us.
But they need to be connected to internet?
Yes.
How are you going to ensure that people who do not have access to internet connectivity still benefit from your mobile?
Also, we can provide a system for offline options without internet. We just get an access from the patient himself to use his voice. Actually, we are not recording any voices or any calls for insurance of privacy. We are just going to use some keywords that may lead to depression or suicidal words or something like this. Thank you.
Thank you.
Any questions?
I see no more questions from there. Okay, question from Dr. Moussawi.
Yeah, if you can elaborate, please, a little bit on how do you think a patient with depression can benefit from this app?
Actually, patient with depression is not the problem of treatment, but it's the problem of being inconsistent with the treatment and with detecting the depression. Mainly, we are detecting depression in its late stages when it's become hard to treat it, but we are going to detect it in its early stages. And patients with depression can benefit from this by the interactive games and exercises and options that we're going to offer him. So it's not just like, you can do this and giving him tasks. No, it's not about this. It's about giving him interactive exercises, games, and things that will attract him to be consistent with his treatment.
Have you studied to what extent patients are willing to have sensors tracking them all the time, or how do you ensure that whatever the app is recommending can be implemented?
Yeah, we have some new AI techniques, artificial intelligence techniques that can track sound and detect some keywords that maybe lead to depression or something like this. Also, we can use some sensors that are related to health through smartwatches, heartbeats, and something like this, because some depression patients suffer from hypertension and heart diseases related things.
You're talking about interactive games.
Yeah.
Of
course. I told you about the chatbots that we are going to create as a part. Yeah, and also we are going to create our friend psych community, which gather all people who are suffering from depression and those who care about mental health. Also, we can make some events in universities, and we are going to participate in expos and in events offline and online with many related organizations that cares about mental health.
Thank you, and
thank you very much.
Thank you, Ms. Mariam, and best of luck. Now we give a moment to generate the final scores. Dear pitchers, best of luck. I would kindly invite Dr. Saleh, Founding Director of the Global Health Institute, to the stage so we can announce the winners. Please note that all of the results are based on today's pitch and on the concept note already shared with us. The third place of the Global Health Changemakers Pitch Competition with seed funding of $2,000 goes to Mr. Abdulrahman Umair. The second place of the Global Health Changemakers Pitch Competition with a seed funding of $3,000 goes to Ms. Sara Al-Kousa from Lebanon. The winner of the Global Health Changemakers Pitch Competition with seed funding of $5,000 goes to Mr. Zishan Zulfikar from UAE.
that was in the bad old days before I met you. When I let you walk into my heart. Congratulations.